So Ben, I know how it is when a patient comes to my office and asks about weight loss, but when a patient comes to your office and asks you, how do I lose weight and how do I get rid of some of these medical conditions that are associated with my obesity?
It's a great question, and it's part of my daily practice for sure. You know, patients come in with a number of chronic diseases, high blood pressure, high cholesterol, fatty liver disease, even a variety of other conditions that are related to weight, and they don't always relate it to their weight. And sometimes you really have to address it head on and talk directly about weight. In my experience, patients really like to discuss privately with their doctor about their weight. There's a lot of societal pressure about obesity and being overweight, and conversations with their doctor are a lot more secure and private. So I talk about, in general at first, I talk about how weight reduction can reduce the risk of what we call comorbidities, which means reducing those numbers that we talk about all the time, like diabetes numbers and blood pressure numbers and cholesterol, things like that. And then we talk about how there's not a one-fit-all approach, right? So there's always diet and exercise that we've been advocating for generations, right? There's medications that we call anti-obesity medications, and then there's surgery, which of course we defer to colleagues like you. And I think that the field is expanding rapidly over the past couple of years with introduction of new medication options, new theories about diet and exercise. And I think that what we generally like to reinforce to our patients is this is something that we have to address because it's going to likely improve all of your associated other diseases as we get the weight down, and it doesn't have to just be one approach. So it doesn't mean that you don't diet and that you don't exercise, but maybe we do every option that we have available because patients are interested in weight loss, we're interested in weight loss, and it really is a crisis in our area and truly throughout the whole world about improving these outcomes for our patients.
I know that we talk about having a better tool to help them lose weight. We know that there is no magic pill out there that can help people lose all the weight they want without any effort at all. There are new medications I know you work with and medications that have been around for many years that you still work with that are still good and very accessible. When it comes to my side, when we talk surgery with people, it's really about providing them with another tool to help them achieve their weight loss goals and overall health goals and improve their quality of life.
Right, and the first visit that I have with patients, specifically ones that are in the higher BMI categories, we talk directly about that. We talk about how surgery is the most effective tool that we still have to help with both long-term weight loss as well as long-term control of the high blood pressure, diabetes, pre-diabetes, high cholesterol, et cetera. And we are very blunt about that. If surgery is not what they want to use as a first tool, maybe we use some other tools first, and then we use that as a backup plan or as an adjunct plan in the future. But we are very open about the data because we always follow science and medical study results, and we tell them that is the most effective way. It surprises many patients. And then you also, as a primary care physician, have to advocate for the safety of them, correct? So both with medication options and with surgical options, there's a lot of myths about the safety protocols. Maybe they've heard horror stories from reading online or talking to friends or family. There's a lot of rumors that go around these things, but kind of trying to bring hard numbers to the concerns the patient has, because at the end of the day, as all physicians, our job is to care for our patients both with their quality of life and their quantity of life years, and these are the tools that are going to do that.
Absolutely, and I love how you talked about safety with the medications and the myth out there about bariatric surgery. I'm always confronting not just patients, but also other primary care doctors out there who are still living in the past with some of the poor outcomes from generations ago. Now with bariatric surgery, we do everything with minimally invasive surgery. Robotics, particularly in our practice, leads to much better, safe results, and people are very happy with their outcomes.
Yeah, and seeing the other side, patients before surgery and after surgery, I'm always excited to see how pleasantly surprised they were about how quick and safe and easy the surgery were. It seems to patients that it's a big thing. They have to take a lot of time off work, or they may have to make a lot of sacrifices for their family, but it really is a surgery that is done very, very quickly and with good long-term results, and the recovery time, which you can speak of more, is really not that long.
Yeah, and it is great though having a combined approach, because we do the surgery, but we know the fight with obesity and people's weight, it's very personal, but it's lifelong. You don't flick a switch and you're not obese anymore necessarily. It's a lifelong process. So whether you start with medication and then go to surgery, or a lot of patients start with surgery and then down the road, we have to refer to see the medical options to continue to evolve the treatment of this very difficult disease.
Something that we should always be advertising, and I should certainly share with my patients, is that this is a chronic disease. This is not a urinary tract infection or a influenza infection that just gets better with time and with appropriate medical treatment. This is a lifelong disease, and whether it's under good control or poor control is up to the doctors and the patients and other providers that are involved in their care. But this is something to expect long term. We know with more research that obesity is not just about lifestyle choices, it's about genetics. It's about lifestyle. It's about social determinants of health. It's about inequities in our system, to where it becomes a lot more complex than just you need to eat less and you need to exercise more, because life is a lot more complicated than that. So it's exciting to have new tools that are available to come from a multidisciplinary approach. And like you said, the approach is not you get surgery and then now you're fixed for life, but now maybe you send them back to primary care physicians or other providers that may be able to assist them in maintenance for long-term medication use. The exciting part about some of the newer agents that are available for weight loss is that they have been studied long-term. It's not a 3-month treatment. It's not a cleanse that's a couple of weeks. This is medications that can be used long-term for years, if not decades, with good safety profiles.
Yep. Yeah, it's a multi-systemic disease, and it's best treated with a multidisciplinary approach: medicine, surgery, as well as our dietitians and exercise physiotherapists that we have at our office, and psychological component we have in our office as well. So it's a whole team approach to a very complex disorder for so many people who are touched by this.